Welcome to our channel Medicine A to Z. Today we are going to discuss some MCQ in asthma. What is the primary pathological feature of asthma? A. Bronchoconstriction. B. Airway inflammation. C. Increased mucus production. D. Airway remodeling. Answer: B. Airway inflammation. Explanation: inflammation of the airways is the hallmark feature of asthma, leading to bronchial hyperresponsiveness, airway edema, and mucus hypersecretion. Which of the following cells play a central role in the pathophysiology of asthma by releasing mediators like histamine and leukotrienes? A. Basophils. B. Neutrophils. C. Eosinophils. D. Monocytes. Answer: C. Eosinophils. Explanation: eosinophils are primarily involved in asthma pathology, releasing inflammatory mediators that contribute to airway inflammation and bronchoconstriction. Intrinsic asthma is often triggered by A. Allergens. B. Respiratory infections. C. Exercise. D. Cold air. Answer: B. Respiratory infections. Explanation: intrinsic asthma is often triggered by non-allergic factors such as respiratory infections, stress, exercise, and exposure to irritants like smoke. Extrinsic asthma is commonly associated with A. Occupational exposure. B. Hormonal changes. C. Emotional stress. D. Cold air. Answer: A. Occupational exposure. Explanation: extrinsic asthma, also known as allergic asthma, is triggered by exposure to allergens such as pollen, dust mites, pet dander, and occupational irritants. Which of the following is not a potential side effect of long-term inhaled corticosteroid use in asthma management? A. Oral thrush. B. Osteoporosis. C. Weight gain. D. Hypertension. Answer: D. Hypertension. Explanation: long-term use of inhaled corticosteroids can lead to local side effects such as oral thrush, systemic side effects including osteoporosis and weight gain, but hypertension is not typically associated with their use. Which biological therapy targets the interleukin-5, IL-5 pathway and is indicated for severe eosinophilic asthma? A. Omalizumab. B. Mepolizumab. C. Benralizumab. D. Dupilumab. Answer: B. Mepolizumab. Explanation: mepolizumab is a monoclonal antibody that targets IL-5 and is indicated for severe eosinophilic asthma, reducing exacerbations and maintaining asthma control. Which of the following is not a common trigger for asthma exacerbations? A. Allergens. B. Cold air. C. Emotional stress. D. Antibiotics. Answer: D. Antibiotics. Explanation: antibiotics are not typically considered triggers for asthma exacerbations. Common triggers include allergens, cold air, and emotional stress. What is the primary objective of asthma management? A. Complete elimination of symptoms. B. Reduction of airway inflammation. C. Prevention of asthma exacerbations. D. Normalization of lung function. Answer: C. Prevention of asthma exacerbations. Explanation: the primary goal of asthma management is to achieve and maintain control of the disease, which includes preventing exacerbations and minimizing symptoms. Which of the following is a potential side effect of long-term use of systemic corticosteroids in asthma management? A. Oral thrush. B. Bone fractures. C. Weight loss. D. Hypertension. Answer: B. Bone fractures. Explanation: long-term use of systemic corticosteroids in asthma management can lead to adverse effects such as osteoporosis and increased risk of bone fractures. Which medication is indicated for severe allergic asthma uncontrolled by other asthma medications? A. Omalizumab. B. Montelukast. C. Theophylline. D. Cromolyn sodium. The correct answer is A. Omalizumab. Explanation: omalizumab is a monoclonal antibody indicated for severe allergic asthma uncontrolled by other asthma medications, targeting immunoglobulin E, IgE. What is the mechanism of action of leukotriene receptor antagonists, LTRs, in asthma management? A. Inhibition of leukotriene synthesis. B. Mast cell stabilization. C. Blockade of leukotriene receptors. D. Reduction of airway inflammation. Answer: C. Blockade of leukotriene receptors. Explanation: leukotriene receptor antagonists, LTRAs, such as montelukast, block the action of leukotrienes, which are inflammatory mediators involved in asthma pathogenesis. Which of the following is not a characteristic feature of severe asthma? A. Frequent exacerbations. B. Poor response to treatment. C. Normal lung function. D. Significant limitation of daily activities. Answer: C. Normal lung function. Explanation: severe asthma is characterized by frequent exacerbations, poor response to treatment, and significant limitations of daily activities despite optimal therapy. However, it often involves abnormal lung function. Which of the following spirometric findings is consistent with asthma? A. Increased forced vital capacity, FVC. B. Decreased forced expiratory volume in 1 second, FEV1. C. Increased FEV1/FVC ratio. D. Normal peak expiratory flow rate, PEFR. Answer: B. Decreased forced expiratory volume in 1 second, FEV1. Explanation: asthma is typically associated with airflow limitation, leading to a decrease in FEV, one due to airway obstruction and reduced expiratory flow rates. What is the primary spirometric indicator used to assess reversibility in asthma? A. Forced vital capacity, FVC. B. Forced expiratory volume in 1 second, FEV1. C. Peak expiratory flow rate, PFR. D. Total lung capacity, TLC. Answer: B. Forced expiratory volume in 1 second, FEV1. Explanation: FEV1 is the primary spirometric parameter used to assess bronchodilator reversibility in asthma, with a significant increase after bronchodilator administration indicating reversible airway obstruction. Which of the following lung function tests is useful for monitoring asthma control over time? A. Spirometry. B. Plethysmography. C. Diffusion capacity testing. D. Lung volume measurement. Answer: A. Spirometry. Explanation: spirometry, which measures parameters such as FEV1 and FVC, is commonly used to monitor asthma control and assess response to treatment over time. Which lung function parameter is assessed using a peak flow meter? A. Forced vital capacity, FVC. B. Forced expiratory volume in 1 second, FEV1. C. Peak expiratory flow rate, PEFR. D. Total lung capacity, TLC. Answer: C. Peak expiratory flow rate, PFR. Explanation: peak flow meters measure PEFR, providing a simple and convenient way to monitor changes in airway function and assess asthma control on a daily basis. Which of the following is a characteristic feature of airway remodeling in asthma? A. Decreased mucus production. B. Thinning of the airway epithelium. C. Smooth muscle hypertrophy. D. Reduction in bronchial hyperresponsiveness. Answer: C. Smooth muscle hypertrophy. Explanation: airway remodeling in asthma is characterized by structural changes such as smooth muscle hypertrophy, subepithelial fibrosis, and increased mucus gland hyperplasia. What role do cytokines such as interleukin-4, IL-4, and interleukin-13, IL-13, play in asthma pathophysiology? A. Promotion of airway dilation. B. Inhibition of airway inflammation. C. Stimulation of IgE production. D. Suppression of mucus production. Answer: C. Stimulation of IgE production. Explanation: cytokines such as IL-4 and IL-13 play a key role in asthma pathophysiology by promoting IgE production, which triggers allergic responses and contributes to airway inflammation. What is the consequence of dendritic cells phagocytosing allergens in the bronchioles? A. Activation of mast cells. B. Release of IgE antibodies. C. Recruitment of eosinophils. D. Presentation of antigens to T cells. Answer: D. Presentation of antigens to T cells. Explanation: dendritic cells phagocytose allergens in the bronchioles and subsequently present the antigens to type II helper cells, the 2 cells. What is the classification of the allergic reaction in asthma? A. Type 1 hypersensitivity reaction. B. Type 2 hypersensitivity reaction. C. Type 3 hypersensitivity reaction. D. Type 4 hypersensitivity reaction. Answer. A. Type 1 hypersensitivity reaction. Explanation. The allergic reaction in asthma involving IgE-mediated activation of mast cells is identified as a type 1 hypersensitivity reaction. Which cell type is primarily activated by IgE antibodies in the allergic response? A. Eosinophils. B. Mast cells. C. Neutrophils. D. Macrophages. Answer. B. Mast cells. Explanation. IgE antibodies activate mast cells, leading to mast cell degranulation and the subsequent release of histamine and leukotrienes. What does SMART therapy stand for in the context of asthma management? A. Simple management and relief treatment. B. Single maintenance and reliever therapy. C. Standardized medication adjustment and response technique. D. Systematic monitoring and asthma response treatment. Answer. B. Single maintenance and reliever therapy. Explanation. SMART therapy, also known as single maintenance and reliever therapy or MART therapy, maintenance and reliever therapy, allows patients with moderate to severe asthma to use a single medication for both maintenance and relief of asthma symptoms. Which of the following medication combinations is used in SMART therapy for asthma management? A. Fluticasone salmeterol. B. Budesonide formoterol. C. Montelukast leukotriene receptor antagonist. D. Albuterol ipratropium. Answer. B. Budesonide formoterol. Explanation. Budesonide formoterol and mometasone formoterol are two medication combinations available for use in SMART therapy. These combinations provide both maintenance and relief treatment in a single inhaler. Which of the following criteria is characteristic of mild intermittent asthma? A. Day symptoms exceeding 2 per week. B. Night symptoms occurring more than 2 per month. C. FEV, 1 less than 80%. D. Day symptoms limited to 2 per week and night symptoms limited to 2 per month, with FEV 1 greater than 80%. Answer. D. Day symptoms limited to 2 per week and night symptoms limited to 2 per month, with FEV 1 greater than 80%. Explanation. Mild intermittent asthma is characterized by infrequent day and night symptoms, with day symptoms occurring no more than 2 days per week and night symptoms occurring no more than 2 nights per month. Additionally, lung function, as measured by FEV1, is typically greater than 80% of predicted values. Which of the following criteria is characteristic of mild persistent asthma? A. Day symptoms exceeding 6 per week. B. Night symptoms occurring more than 4 per month. C. Severe limitation of activity. D. Day symptoms ranging from 3 to 6 per week. D. Day symptoms ranging from 3 to 6 per week. Night symptoms limited to 4 per month, with FEV 1 greater than 80%. Explanation. Mild persistent asthma is characterized by symptoms occurring on most days of the week, 3 to 6 days, mild limitation of activity, and infrequent night symptoms, up to 4 nights per month. Lung function, as measured by FEV1, is typically greater than 80% of predicted values. Which of the following is not a characteristic of asthma? A increase in IgG immunoglobulins, B. Airway hyperresponsiveness, C. Infiltration of eosinophils into the airways, D. Increased mucus production. A. Increase in IgG immunoglobulins. Explanation. Asthma is characterized by chronic airway inflammation, bronchial hyperresponsiveness, and airflow obstruction. Immunoglobulin E, IgE, plays a crucial role in the pathophysiology of asthma as it triggers allergic responses and activates mast cells, leading to the release of inflammatory mediators. However, there is typically no significant increase in IgG immunoglobulins in asthma. IgG is primarily associated with adaptive immune responses to bacterial and viral infections, rather than the allergic and inflammatory processes characteristic of asthma. Therefore, an increase in IgG immunoglobulins is not a characteristic feature of asthma. The most common allergens associated with asthma in the United Kingdom are, in order of importance, A. Pollens, house dust mite, fungal spores, B. House dust mite, pollens, animal dander, C. House dust mite, pollens, fungal spores, D. House dust mite, animal dander, pollens, B. House dust mite, pollens, animal dander. Explanation. In the United Kingdom, the most common allergens associated with asthma are house dust mites, pollens, and animal dander. House dust mites are a significant allergen due to their prevalence in indoor environments, particularly in bedding, upholstery, and carpets. Pollens from trees, grasses, and weeds are also common triggers, especially during the pollen seasons. Additionally, animal dander, primarily from cats and dogs, can exacerbate asthma symptoms in individuals sensitized to these allergens. This order of importance reflects the frequency of exposure and sensitization to these allergens among individuals with asthma in the UK. The immediate response of asthma involves A. Mast cell degranulation, B. Binding of antigen to IgE on macrophages, C. Release of cytokines such as IL-13, D. Activation of cholinergic nerves. A. Mast cell degranulation. Explanation. The immediate response of asthma involves mast cell degranulation. When an individual with asthma is exposed to an allergen to which they are sensitized, the allergen binds to IgE antibodies on the surface of mast cells. This binding triggers mast cells to release a variety of inflammatory mediators, including histamine, leukotrienes, and prostaglandins, which initiate the cascade of events leading to bronchoconstriction, airway inflammation, and other asthma symptoms. Mast cell degranulation is a hallmark feature of the immediate allergic response in asthma. Which test is not used during diagnosis or monitoring of asthma? A. Diffusing capacity, B. Peak expiratory flow rate, C. Bronchial challenge test, D. Skin prick test. The correct answer is A. Diffusing capacity. Explanation. Diffusing capacity testing, also known as diffusing capacity of the lungs for carbon monoxide, DLCO, is not typically used during the diagnosis or monitoring of asthma. DLCO testing primarily assesses the ability of the lungs to transfer gases from the air sacs into the bloodstream, which is more relevant for conditions affecting the lung parenchyma and pulmonary vasculature, such as interstitial lung diseases or pulmonary embolism. Long-acting beta-2 adrenoreptor agonists. A. Work by increasing cGMP in airway smooth muscle. B. May become less efficacious due to tolerance after long-term use. C. Can be used as the sole therapy in asthma. D. Are the first choice for a reliever therapy. B. May become less efficacious due to tolerance after long-term use. One of the limitations associated with LABAs is the potential development of tolerance with long-term use. This means that over time, the effectiveness of LABAs in bronchodilation may decrease, requiring higher doses or additional medications for adequate asthma control. Therefore, it is essential to use LABAs in combination with inhaled corticosteroids, ICS, as controller therapy rather than as monotherapy to prevent the development of tolerance and achieve optimal asthma management. A. LABAs work by increasing CAMP, not cGMP, in airway smooth muscle. C. LABAs are not recommended as sole therapy in asthma due to the risk of exacerbations. They are typically used in combination with ICS. D. LABAs are not the first choice for reliever therapy. Short-acting B2, adrenoreceptor agonists, SABAs, such as albuterol, are commonly used as reliever therapy for acute asthma symptoms. Which of the following is not a common adverse effect of low-dose inhaled steroids? A. Cough. B. Weight gain. C. Oral candidiasis. D. Hoarseness. B. Weight gain. Weight gain is not a common adverse effect associated with low-dose inhaled steroids. A. Cough. Inhaled steroids may cause throat irritation and cough, particularly when patients do not use a spacer device or fail to rinse their mouth after inhalation. C. Oral candidiasis, thrush. Inhaled steroids can increase the risk of oral thrush, a fungal infection of the mouth due to local immunosuppressive effects. This risk can be minimized by using a spacer device and rinsing the mouth after each use of inhaled steroids. D. Hoarseness. Inhaled steroids may cause hoarseness or voice changes as a result of local effects on the throat and vocal cords. This effect is usually mild and transient, but can be minimized by using a spacer device and rinsing the mouth after inhalation. Stay updated with the latest in medicine. Subscribe to our channel for comprehensive videos covering the latest updates in the field.